Imagine a single pill that could dramatically improve heart health for those battling heart failure. Sounds too good to be true. Well, a recent study suggests it might be a reality. A groundbreaking trial has shown that a Polypill, containing a combination of medications, significantly boosts heart function and overall outcomes for patients with heart failure and reduced ejection fraction, HFrEF. This innovative approach, detailed in the Poly-HF trial, involved a polypill that included a beta blocker, a mineralocorticoid antagonist, and an SGLT2 inhibitor. The results are compelling. Patients taking the polypill showed a marked improvement in their adherence to guideline-directed medical therapy, leading to tangible benefits in their heart health. Compared to standard care, the polypill demonstrated enhanced adherence, an increase in the left ventricular ejection fraction, LVEF, and a reduction in hospitalizations over a 6-month period. Dr. Ambarish Pandey, the lead investigator from UT Southwestern Medical Center, highlighted these positive outcomes. The study's design was straightforward. The 3 medications were simply combined into a single capsule, a process known as over-encapsulation. This study marks the first randomized evidence of a polypill's effectiveness in treating heart failure. The trial, conducted at 2 centers in Dallas, randomly assigned 212 patients to either the polypill or usual care. The control group received the same medications prescribed by their cardiologists or primary care physicians. Both groups also received a renin-angiotensin blocker, which was offered separately in the usual care group. For the primary outcome, the LVEF at 6 months, the polypill group saw a statistically significant increase of 3.4% compared to the control group. This improvement correlated with better adherence to medication in the polypill group, as monitored through blood levels. The proportion of patients on optimal doses of guideline-directed medical therapy was notably higher in the polypill group at 1, 3, and 6 months. Furthermore, the polypill group experienced a 60% reduction in heart failure hospitalizations, emergency department visits, and deaths during the follow-up period. Quality of life also improved, as measured by the Kansas City Cardiomyopathy Questionnaire, KCCQ, with the polypill group showing an 8.5-point advantage, exceeding the 5-point threshold considered clinically meaningful. The polypill was available in 4 formulations, varying the dose of the beta-blocker metoprolol. Each pill contained a fixed dose of the SGLT2 inhibitor empagliflozin, 10 mg, and the mineralocorticoid spironolactone, 12.5 mg, with metoprolol doses of 10 mg, 50 mg, 100 mg, or 150 mg. What's particularly striking is the study population's demographics. The trial primarily focused on an underserved urban population, with 68% of participants uninsured or relying on county-sponsored health programs. Many faced significant challenges, including food insecurity, 42%, and housing instability, 32%. The median age was 54 years, and the population had a high burden of comorbidities. But here's where it gets controversial. The polypill was produced without any special technology, using standard drug doses combined into a single pill. Dr. Pandey emphasized that anyone could do this. However, Doraraj Prabhakaran, from the World Health Organization's Center for Chronic Disease Control, suggests that financial incentives might be necessary to encourage the commercial production of such a polypill. Prabhakaran, who served as a discussant for the trial, highlighted the urgent need for new approaches to address the issue of non-adherence to guideline-directed medical therapy in heart failure. He pointed out the stark contrast in survival rates between heart failure and cancer, emphasizing the critical need to optimize treatment. He noted that, unlike cancer, where the 5-year relative survival rate is around 69%, the rate for heart failure patients is closer to 50%. In India, the median survival for heart failure patients is only about 3 years. Prabhakaran stresses that taking only some of the recommended medications or lower doses when full doses are tolerated is insufficient. Each medication contributes to reducing mortality. Both Prabhakaran and Pandey observed that most studies show less than half of heart failure patients are on optimal doses of all guideline-directed medical therapy. Prabhakaran views the polypill as an attractive option, noting that the Poly-HF trial supports its use, even as we await the results of larger trials with hard endpoints. And this is the part most people miss. The trial was investigator-initiated and did not receive industry funding. Dr. Pandey disclosed financial relationships with several pharmaceutical companies. Prabhakaran reported no potential conflicts of interest. What are your thoughts on the potential of polypills in treating heart failure? Do you think this approach could revolutionize patient care, or are there potential drawbacks? Share your opinions in the comments below.